All right, this segment is sponsored by Springfield Clinic, and I'm here with Dr. Bhuvnesh Aggarwal with the Springfield Clinic Cardiology Department. Now, we're talking about valves, and can you talk about the valve team and what you all do?
Yes, thank you. So our valve team is a multidisciplinary structural heart team that includes a cardiologist, a cardiac surgeon, and valve team coordinators. As a team, we meet every week to discuss patients with complex valve conditions and cohesively come up with a plan tailored to each patient's specific need.
Gotcha. And what are some of the common conditions you all see in patients?
Yes. So heart has 4 valves, but predominantly we see 2 main valve conditions that affect patients. The most common condition we see is called aortic valve stenosis, or narrowing of the aortic valve. This valve sits between the heart and the rest of the body, and as the heart pumps blood to the body, it has to pass through this valve which opens and closes with every heartbeat. And sometimes as we grow older, you can have deposits of calcium on this valve, which makes the valve really narrowed and causes chest pain and shortness of breath, and if left untreated, could be life-threatening.
At what point do you think someone would need to, get that checked on?
If you've been told you have a heart murmur and you notice chest pain or shortness of breath or dizziness, that is sometimes a signal that you got to have your valve checked.
Got it. And then you were also telling me about some new options for patients. Tell me about that.
Yeah. In the past, if you have these valve conditions, the only option was open heart surgery. But nowadays, we have a minimally invasive option where instead of open heart surgery, we can go in through the leg through a small incision and do a new valve replacement. And patients are often awake for this procedure. They're able to walk within hours and usually go home the next day.
Wow, how long has that been around?
It's been around for about 7 to 10 years, but it has come into limelight in the last few years only as we've gotten better with this procedure.
Yeah, and it is Wellness Wednesday, and of course it's Heart Health Month. Why do you think it's so important for people to just be mindful of what's going on inside their bodies?
Yeah, it's very important because heart disease, unlike what most people think that there are telltale signs with chest pain and such things, often heart disease can be silent and it can slowly creep up on you. And before you know, it's in a very bad condition and often could be life-threatening. It's very important to pick up signals of heart disease which could be subtle, including slight chest pain, fatigue, weakness, and get yourself evaluated.
Yeah, thank you, Doc. Great advice and great tips. Thank you for being here with us this morning.
My pleasure.